If you are living with arthritis and feel like your joint pain is not improving despite medications, exercise, or a healthy diet, the real problem may not be your age or just your joints. In many cases, the missing piece is mineral deficiency. Research shows that people with arthritis are very often low in certain essential minerals that help control inflammation, protect cartilage, strengthen bones, and support muscle and nerve function. When these minerals are lacking, inflammation increases, joints weaken, stiffness becomes worse, and pain feels more intense. That is why many patients feel stuck, even when they're doing everything they think is right. In this video, we will talk about the 3 most important minerals every arthritis patient should take daily to help reduce joint pain, calm inflammation, and improve movement. I will explain how these minerals work inside your body, why deficiencies are so common in arthritis, and how to use them safely and effectively so your joints can actually start feeling better. The first and most important mineral for arthritis patients is magnesium. Magnesium is one of the most overlooked minerals, yet plays a role in more than 300 processes in the body, many of which directly affect joint health. It helps regulate inflammation, relax muscles, calm the nervous system, support bone strength, and protect cartilage. Studies consistently show that people with osteoarthritis and rheumatoid arthritis tend to have lower magnesium levels, and this deficiency is closely linked to increased joint pain, stiffness, muscle cramps, fatigue, and reduced mobility. When magnesium is low, the body shifts into a more inflammatory state, which accelerates joint degeneration and makes pain feel worse. One of magnesium's most powerful benefits is its ability to control inflammation at a cellular level. Arthritis pain is driven by chronic inflammation, and magnesium helps suppress inflammatory chemicals, such as C-reactive protein, interleukin-6, and tumor necrosis factor alpha. These markers are usually elevated in people with arthritis. Research shows that individuals who consume adequate magnesium have lower levels of systemic inflammation. When magnesium levels are sufficient, the immune system is less likely to overreact, which helps reduce joint swelling, slow cartilage breakdown, and decrease pain over time. Magnesium is also essential for muscle relaxation, which is extremely important for arthritis patients. Many people focus only on the joints, but tight, spasming muscles around painful joints can dramatically increase discomfort and limit movement. Magnesium acts as a natural muscle relaxant by balancing calcium in the muscles. Without enough magnesium, muscles stay tense, leading to stiffness, cramps, and extra pressure on already inflamed joints. This is why many arthritis patients notice improvements in morning stiffness, muscle tightness, and overall mobility after correcting magnesium deficiency, especially in the knees, hips, shoulders, and spine. Another key role of magnesium is in bone and cartilage health. About 60% of the body's magnesium is stored in the bones, where it works closely with calcium and vitamin D to maintain bone density and structural strength. Magnesium helps calcium enter the bones properly and prevents it from depositing in soft tissues, which can worsen joint stiffness and calcification. Low magnesium intake has been linked to reduced bone mineral density and a higher risk of osteoporosis, a condition that often occurs alongside arthritis and further increases joint pain. By supporting stronger bones and healthier cartilage, magnesium helps joints tolerate daily movement with less stress and discomfort. Magnesium also plays a direct role in pain perception. It helps regulate NMDA receptors in the nervous system, which are responsible for amplifying pain signals. When magnesium levels are low, these receptors become overactive, making pain feel stronger and more persistent. Restoring magnesium levels can help calm these pain pathways, making joints feel less sensitive and improving overall quality of life. This is one reason magnesium is frequently recommended for chronic pain conditions, including arthritis. Although magnesium is found in foods such as leafy green vegetables, nuts, seeds, legumes, and whole grains, many people do not get enough through diet alone. Modern farming practices, stress, aging, certain medications, and chronic inflammation all increase magnesium loss in the body. For most arthritis patients, supplementation becomes necessary. A daily dose of around 200 to 400 milligrams is generally effective, starting low and increasing gradually. Magnesium glycinate is one of the best forms for arthritis because it is well absorbed and gentle on the stomach. Magnesium malate is also helpful, especially for muscle pain and fatigue. Taking magnesium in the evening often improves sleep and reduces nighttime stiffness, which is essential for healing and pain control. The second essential mineral for arthritis patients is calcium. Calcium is commonly associated with bone health, but its role in joint stability, muscle function, nerve signaling, and overall mobility makes it especially important for people with arthritis. Arthritis patients, particularly older adults and postmenopausal women, are at higher risk of low calcium intake, bone loss, and osteoporosis. Weak bones place extra stress on the joints, increasing pain, stiffness, and the risk of fractures. When calcium levels are inadequate, joints lose structural support, muscles fatigue more easily, and daily movement becomes more difficult and painful. Calcium plays a critical role in maintaining strong bones that support and protect the joints. In osteoarthritis, cartilage gradually wears down, causing more pressure on the underlying bone. If calcium intake is low, bones become thinner and weaker, accelerating joint damage and worsening pain. Research shows that low bone mineral density is associated with increased joint pain and faster progression of arthritis, particularly in weight-bearing joints like the knees and hips. Adequate calcium intake helps bones remain strong and resilient, allowing joints to better absorb shock and reduce mechanical stress during movement. Calcium is also essential for proper muscle contraction and relaxation. The muscles surrounding the joints act as stabilizers and shock absorbers. When calcium levels are low, muscles may become weak, cramp easily, or fail to support the joints properly. This places additional strain on already inflamed joints, leading to more pain and stiffness. Balanced calcium levels help muscles function smoothly, improving stability, balance, and overall mobility, which is especially important for arthritis patients who struggle with walking, standing, or climbing stairs. In addition, calcium plays a role in nerve transmission and pain signaling. Proper calcium balance helps regulate how pain signals are sent to the brain. When calcium levels are unstable, nerve signaling can become erratic, which may intensify pain perception. Maintaining adequate calcium levels supports more stable nerve function and helps make joint pain feel more manageable over time. Calcium is found in foods such as dairy products, leafy green vegetables, fortified plant milks, almonds, sesame seeds, tofu, and small fish with edible bones like sardines. However, many people do not absorb calcium efficiently as they age, and those who avoid dairy or have digestive issues are at even higher risk of deficiency. For most adults, a daily intake of about 1,000 to 1,200 milligrams is recommended. It is important not to exceed this amount unnecessarily, as excessive calcium without proper balance can lead to calcium deposits in soft tissues and joints. Calcium should never be taken alone. It works best when combined with vitamin D, magnesium, and vitamin K2. Vitamin D helps the body absorb calcium. Magnesium regulates calcium balance at the cellular level, and vitamin K2 directs calcium into bones rather than into arteries or joints. Calcium citrate is generally the best supplement form for arthritis patients because it is well absorbed and gentle on the stomach. Taking calcium in divided doses improves absorption and reduces side effects. The third essential mineral for arthritis patients is zinc. Although zinc is needed in smaller amounts than magnesium or calcium, its impact on inflammation, immune regulation, and tissue repair is extremely powerful. People with inflammatory forms of arthritis, especially rheumatoid arthritis, often have lower zinc levels. This deficiency is associated with increased inflammation, more severe joint damage, slower healing, and higher pain levels. Zinc plays a crucial role in regulating the immune system. In autoimmune arthritis, the immune system mistakenly attacks joint tissue, leading to chronic inflammation and damage. Zinc helps keep immune responses balanced, preventing excessive release of inflammatory chemicals such as TNF-alpha, interleukin-1, and interleukin-6. When zinc levels are adequate, immune cells are less aggressive, which helps reduce joint swelling, pain, and long-term damage. Zinc is also essential for antioxidant protection. Inflamed joints produce high levels of free radicals that damage cartilage and surrounding tissues. Zinc is a key component of antioxidant enzymes that neutralize these free radicals before they can cause further harm. Low zinc levels weaken this defense system, allowing oxidative damage to accelerate joint degeneration. Adequate zinc intake helps protect joint structures and preserve mobility. Another important role of zinc is tissue repair. Zinc is required for cell division, protein synthesis, and collagen formation, all of which are necessary for repairing damaged cartilage, ligaments, and tendons. In arthritis, joints are constantly exposed to inflammation and mechanical stress. Without enough zinc, the body struggles to repair this damage, leading to persistent stiffness and pain. Restoring zinc level supports healing and improves joint function over time. Zinc also influences pain perception by stabilizing nerve signaling. When zinc is low, pain signals can become amplified, making arthritis pain feel more intense. Correcting zinc deficiency helps normalize pain transmission, making discomfort easier to manage. Zinc can be obtained from foods such as meat, eggs, dairy, legumes, nuts, seeds, and whole grains. For many arthritis patients, supplementation in the range of 15 to 30 milligrams per day is beneficial, but long-term intake above 40 milligrams should be avoided unless supervised by a healthcare professional. Zinc picolinate and zinc citrate are well-absorbed forms and are generally preferred. Now that you understand how magnesium, calcium, and zinc work together, it becomes clear that arthritis management is not just about painkillers or temporary relief. These minerals support your joints from the inside out by reducing inflammation, strengthening bones, calming the immune system, and improving healing. Arthritis does not develop overnight, and healing also takes time. However, small and consistent nutritional changes can create powerful improvements in pain, stiffness, and mobility over the long term. By giving your body the minerals it needs every day, you're not just masking pain, you are addressing one of the root causes of joint damage and inflammation. If you found this information helpful, make sure to like this video, share it with someone who is struggling with joint pain, and subscribe to the channel for more simple, science-based health guidance. Let me know in the comments which mineral you feel your body needs the most right now. Remember, your joints are meant to move. Give them the support they deserve, and I will see you in the next video.